Hello, I'm Certified Financial Planner Chris Cooper. Today we're talking about Obamacare, the Affordable Care Act. For many of you who are between ages 50 and 64, listen up. You're the group that's going to get the most benefit out of Obamacare. For many of you, you've had to take early retirement, or some of you may have lost your jobs, and then trying to get a job when you're in your 50s is definitely a very difficult task. So for you, most of you may not have health insurance, or your employers had health insurance and had to let it go, or they're actually eliminating their health insurance coverage, as is happening in some states with some state and government employees. So many of you will now need to go to the health insurance exchanges, which open on October 1st, and enroll. What you do then is you go to the health insurance exchanges, either at the federal level or on your state's level. In California, we have our own exchanges. For many of you who don't have your own exchanges, you'll go to the federal at healthcare.gov. You'll compare different plans, select one based on your desires, needs, and premium costs, and then you'll also apply. But when you apply, you'll notice that there'll be information for you to put in your income information, such as W-2 or self-employment income. That's because for many people there will be a subsidy. Some people will receive a very large subsidy because their income and the number of dependents they have is quite high, so therefore their income's too low for the number of dependents, they get a bigger subsidy. Those of us that are single may not receive much of any subsidy, again, depending on income. These are helpful for helping you to pay that premium, but the bigger thing that's more important, whether you get a subsidy or not, is that you get health insurance coverage and that you don't walk around without it. Health insurance coverage is critical. It's just as important as car insurance or fire insurance on your home, because it can bankrupt you if you have a health issue. So these things are more important because we look at them as risk management tools as opposed to health care tools. And that's what the most important part of Obamacare is that it is a risk management tool. Many people will still equate it as, oh, I'm going to go to the doctor now and go to the hospital and get lab care. Yes, you will, and many of them will do better and live better lives and will be less of a cost for the rest of us in the system by the shifting of costs between the uncompensated care that doctors and hospitals receive and those of us who do pay for our care through our insurance. Now everyone will have insurance and thus will have a level playing field for all providers. This, I think, is one of the more important parts, but it's something we won't see the great results of for many years to come. The other thing that's important, though, is that you will be able to retire or go into self-employment without having to worry about getting health insurance coverage from an employer. And that, I think, is the most important part of Obamacare.